HIV is the human immunodeficiency virus. If you have HIV, you have an infection that damages your immune system over time and causes AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. It is the final stage of an HIV infection when the immune system is damaged and too weak to fight off ordinary infections. HIV passes from person to person through infected body fluids. HIV can enter the body during unprotected sex, sharing drug injection needles, during your own childbirth, while breastfeeding from your mother, or from contaminated blood or blood products. Although there is no cure for HIV, drugs called antiretroviral medication can reduce the amount of HIV in the body. One class of antiretroviral medication called entry or fusion inhibitors disrupts the HIV infection replication by preventing the virus from attaching to the cells. Other classes of antiretroviral medications include reverse transcriptase inhibitors, protease inhibitors, and integrase inhibitors. These drugs prevent the creation, assembly, and spread of new viruses. The doctor may prescribe a combination of these drugs classes known as highly active antiretroviral therapy or HAARTs. Antiretroviral medication doesn't completely remove HIV from the body, but slows down enough to enable the immune system to fight infections. Regular blood tests will let the doctor know how effective the antiretroviral medication is controlling HIV. If the number of helper T cells is high enough in the blood sample, then the medication is working. Treatments for the opportunistic infections of AIDS are medications specific for each type of infection. For example, the doctor may prescribe antibiotics in case of pneumonia or tuberculosis. To avoid guarding or spreading HIV infection, know your HIV status and your partner's status by getting tested regularly. The most effective way to prevent HIV infection is to avoid vaginal and anal sex. Listen, when engaging in sexual activity, you'll be less likely to contract HIV if you only have sex with one uninfected partner or use latex condoms for protection. Avoid using injectable illegal drugs or sharing drug needles because these needles may have the virus on them. Avoid intoxication from drugs or alcohol because you'll be more likely to engage in unsafe sexual behavior.